I had one shift where I saw about 84 patients.
The first 21 days we had to work consecutively without an off day. These are 12, 13-hour shifts.
I do 7 days in a row of 12-hour shifts in the ICU. That's all COVID patients. That's definitely a huge shift from my usual world of gastroenterology.
So I was the first faculty doing that COVID week. All of our patients ended up being COVID-19 positive. Some of those patients ended up, passing away, unfortunately, but, we had to keep on moving.
I've been working as a primary care doctor over the last 4 years now. This is certainly the wildest thing any of us has seen.
Typically, we see very diverse racially and socioeconomically patient population. And it was interesting because I mentioned to our staff a few weeks ago, I said, do you notice that more of our patients coming in, they look like us? And everyone said, oh, absolutely.
Historically, African Americans and other minorities such as Hispanics have disproportionate numbers of hypertension, diabetes, high cholesterol. These things are hard and challenging to manage on their own. They also weaken the immune system, weaken the ability to heal.
Unfortunately, those diseases tend to track with structural and systemic factors around the country, and those include lower income, lower rates of employment, lower rates of access to insurance.
When you put like a crisis on top of a crisis, these communities are going to do the most poorly.
The patients that I noticed that didn't do too well, they were actually the patients who were obese, who had a BMI, a body mass index greater than 30, 35. Those were the patients that we saw who needed the ventilators, they needed the machines to help them breathe.
Diabetes is unfortunately 60% more common in African Americans than in our white counterparts. The risk of diabetes is higher due to issues around diet, due to issues around treatment of other chronic conditions that worsen diabetes, such as obesity.
Really getting through to people of color, especially elders, in regard to their diet is definitely challenging. They grew up eating the scraps of food, the portions of food high in salt and high in fat.
I know from growing up in Detroit in a low-income family that when you have to feed your family, buying fresh fruits and vegetables is not necessarily affordable. And so if you're turning to these calorie-dense foods, you'll get your family fed. Unfortunately, what comes with that, though, is obesity and diabetes and high blood pressure.
Food deserts really influence the way people eat. If you don't have access to the green vegetables, to the healthy fruits, unfortunately, you're going to be more likely to buy the chips, the soda, the processed foods that increase one's rates of diabetes.
We started seeing more Black and brown patients over the last few weeks, and some of them were essential workers. They didn't have the luxury of working from home, and we saw less white patients or patients that could work remotely from home. It was, as I said, incredibly striking.
Right now, we know that there are still states, for example, that did not expand Medicaid to be able to ensure that the lowest income Americans, who unfortunately in our society tend to be from Black and brown backgrounds, have access to insurance. We know there are about 27 million uninsured in the country right now, and a much higher proportion of those individuals are Black and Hispanic.
We've had a number of patients come into our urgent care at the front desk and asking if, how much they will have to pay, how much do they have for the visit, how much do they have to pay if they were to get testing. So these are real concerns and absolutely a barrier, especially for people who are undocumented and who don't have insurance.
Many people don't know how to advocate their health because maybe they've not had the resources or they're not comfortable going to the doctor. So yes, you see that they'll show up when things are so bad, or they're knocking, on death's door, for lack of better words.
Workforce diversity, we know, is one of the solutions to addressing racial healthcare disparities. And the fact is that especially among physicians and nurses and other healthcare professionals, our numbers are quite low when you compare our numbers in the US population.
So if you were to ask me, overall, is it diverse here in terms of the physician population? I'd say to a degree. In terms of diverse, in terms of a large number of underrepresented minorities, I would say no. Me, I'm the first African-American advanced endoscopy fellow here, period. And it's, I started this fellowship in 2019. We're 2020 now, and to say that I'm the first African-American advanced endoscopy fellow here is really mind-blowing. That Yale does an excellent job of really trying to, recruit minorities. It's just, it's a slow process.
When you're in the healthcare setting, it's already a scary and trying time to begin with. And when you don't, see anyone that looks like you, that can be even more concerning.
And so I've definitely seen that, like time and time again, where patients are just so excited to see another Black doctor, and actually, they will go out of their way to find a Black doctor. So when you go into the room and then you say, I'm Dr. Campbell, you just see a lot of times their face just lights up with this pride, and it's like, wow, I'm just really happy to see you here as a physician.
I think it makes all the difference when you can see someone who looks like you. The patients are just, as you can imagine, more receptive to what you're saying. I feel that there's even a sense of ease or calm that might not be there otherwise.
Growing up, it was quite normal for me to see loved ones and families and friends dying in their 40s and 50s and thinking that was normal. As I got older and went off to college and so forth, I came to realize that no, that's not normal. Those are disparities and they're avoidable.
People who've been doing this work, we knew that these disparities existed, and we knew that this pandemic would only worsen or even just expose these inequities. And so what I'm hoping is that that this horrible time, this basically nightmare that we're in, actually something good comes out of it, and that good would be for public health officials, for government officials to really think about how we can prevent this from happening in the future.